I'm Michael Leahy, and I'm the founder and executive director of Brave Hearts. We're a ministry based out of Atlanta, Georgia, and our mission is to lead people to freedom from habitual sexual sin, and we do that through a faith-based recovery program that I've developed, which is mentoring-centric or mentoring-based. So we talk about sexual integrity discipleship as we help people, men especially, get set free from this addiction. Yeah, mentoring means a lot of things to a lot of different people. So the way that we use it in Brave Hearts to help men is there's a couple different areas or ways. Number one is one-on-one mentoring. And that is a relationship that I like to describe going deep and long with someone. So typically a person will come to me for help saying that they're struggling, they're looking for freedom, they realize they can't do it themselves. And so I'll typically we'll set up times to meet once a week. And I very quickly started getting requests from all over the country, so I started using the phone and video conferencing to do that. So we'll typically meet for about an hour a week. And in between our appointments, what they'll do is they'll have some curriculum, some lessons that they need to read that are all part of the learning process of what sexual addiction looks like or what sexual integrity looks like, per se. So they'll have about an hour and a half to 2 hours worth of homework a week. And what we do in our meeting, our 1 hour meeting, is first they check in with me. So they go through answering a series of questions that I have on a worksheet for them, mostly related to their level of struggle that past week with sexual temptation and sexual sin. So it's kind of comes out of the 12-step world of checking in. But I have some detailed questions, about 11, that I ask them to go through and answer. Things as simple as rate your past week on a scale of 1 to 10 in terms of your degree of struggle, to, interestingly, the most difficult question for all of them to answer, which is, give me 4 feeling words that represent your past week. And it's just incredible how hard a time guys have coming up with words that represent emotions and feelings. But it's understandable to me because, this is an intimacy disorder. And so one of the things that is the unfortunate cost or consequence of using pornography is that they lose touch with their emotional sin, their emotional being. So anyhow, we do the check-in for about 15 minutes usually. And then the rest of the time that I spend with them in the one-on-one session is I have them present the lesson to me. So I just I start off by saying, let's talk about the lesson. What are your thoughts? And they know that's the cue to go ahead and take me through page by page, paragraph by paragraph, talking about any takeaways, any things that they feel they related to or related to their situation. And we talk about a lot of different topics, everything from triggers, from the sexual addiction cycle, from family of origin issues, a whole host of topics in a year-long curriculum. So that's what one-on-one mentoring looks like. Now I also do group mentoring, and group mentoring is very different. In group mentoring, I'm more the teacher, and it's discussion-based, but we usually have anywhere from 4 or 5 to 15 or 20 people on a video conference at one time. It's really exciting to have people from all over the country and sometimes all over the world in on these. And we don't do the checking in time because we don't have enough time to go through that, but I actually have them break down into teams outside of our group mentoring time, where small teams of 6 to 8, where they meet with each other on a regular basis for about a half hour to be able to check in with each other for the accountability. So that means that in my group mentoring sessions, I can totally focus on the teaching. And I usually try to limit the teaching and spend most of the time in discussion. I want to get them talking. I want to get them, sharing their experiences. Because one of the things that is really key to getting healthy after you've been struggling with this for a long time is connecting with others, where you know that you're not being judged, you're not being condemned, and these are guys that are experiencing similar things that you've experienced. So there's a very freeing sense of, this is a safe place, I can say whatever I want to say, I moderate it to make sure it stays, within boundaries. And the guys grow over time as a community. The typical length is about 18 months. but before they feel like they've grown enough, and then they kind of move on, because some can't afford to continue to do that. But so that's the way I do mentoring. Other people have different approaches to mentoring, but for recovery especially, I find that that's a good combination. That's what I've come up with after doing this for about 6 years. The mentoring journey can go back into childhood pain, can go back into past trauma, but I want to be sure and distinguish between mentoring and counseling, because I've worked with a number of men who have had some very traumatic pasts where it's really out of my wheelhouse to be able to help them. And I've referred them on to professional counseling, because there's certain things that I believe a mentor can do better than a counselor or a therapist, and other things that clearly a professional trained counselor or therapist should be doing and we shouldn't have anything to do with. So when we get into big issues that are trauma related, issues that may have to do with post-traumatic stress or PTSD, ADD, any other, depression, anxiety disorder, any other kind of mental illness area. I always stress to my mentors that I'm training, and I practice this myself, to know your limits. Know that you're not a counselor. And actually, when you explain what you're there to do with counselors, then a lot of times they love teaming up with a mentor, because we get to do the things that they can't do in the time in between their meetings, their sessions with a counselor, which is I'm going to be there for him to be able to relate to help hold him accountable, to make him feel safe and supported and accepted on the journey. But I can also slap him upside the head when I see him doing things that I've done before and I know are unhealthy or negative, damaging attitudes toward recovery or what have you, that might escape a counselor who hasn't been a recovering sex addict themselves and maybe just had the book knowledge of it. The whole area of sexual compulsivity and addictive behaviors is still not recognized by the American Psychiatric Association as a bona fide mental illness, which means that it lacks the legitimacy in the professional circles, that not just the legitimacy, because a lot of them see it as a legitimate illness and will help people as best they can, but it lacks the how would I say this? It lacks the classification by the American Psychiatric Association, the APA, to be able to classify this in a way that insurance companies will pay for treatment, that employers will offer coverage to their employees for treatment. So, and there are probably some political things involved in that, certainly, but the bottom line is people are struggling in this area, and so they're looking for knowledgeable, educated, trained people to help in this area. And because it's not a source of steady income for folks in the professions, typically, since it lacks that legitimacy, then it's kind of hard to find people who are really good at counseling and really good in therapy in this area. The other thing is, you have to understand that a person who has struggled with sexually addictive behavior typically started, not the addictive side of it, but they started their relationship with porn usually in their preteen years. And so they've been learning to lie and to obscure the truth ever since they were a little kid. And it can be really difficult for a therapist, a counselor, even a mentor like myself to work with someone who's a compulsive pathological liar. That's what I was after 30 years in my relationship with pornography. And usually you get undone by your lies, losing track of them, right? And my ex-wife at the time, and my wife at the time, now ex-wife, she could keep track of all of the things I was saying, but I would lose track of them, because that's just what addicts do as they get more and more unhealthy. So I remember in the first couple of years that I went through recovery, but not really wanting to get well, I'd never met a counselor or a sex therapist or any psychiatrist. Never met anyone that wasn't an easy mark for me. It was just like taking candy from giving candy to a baby, basically. I could spin a web of lies that would make it look like my wife was the one who was really the fault, the problem in the relationship. Very manipulative, very controlling, very arrogant, but in a way that I had this crafted down ever since I was 11 years old. So there are some counselors and therapists who are very good at this, but they typically have this personal story as well, that they've been through recovery as sex addicts themselves. I think it's very hard for a man to see a woman counselor or therapist. Doesn't mean they can't help him, but I don't think that women could really understand what this looks like for a man any more than a man could, struggles that a woman might have in this area. So that's why I'm so excited about mentoring, because what we look for in Brave Hearts are men and women who have walked this walk. They've been on this journey, like I shared earlier. They're like the Sherpa guides. They've taken that trip to the top of Mount Everest many times, and they can they're well equipped to be able to take anyone else on it because they've walked in those shoes. And when you're on the receiving end of that, like I was when I went through my recovery, when I really tried to get well, you pick up on it very quickly that this is someone you can't BS. That he's going to call me out anytime I try to pull the wool over his eyes. And so I'm either in it or I'm not. And that's I think that's the real beauty of the mentoring relationship in terms of being so effective, I think, on helping people get well. We're having a greater than 50% success rate for long-term sexual sobriety, which is unheard of in the area of addiction recovery. Usually it's only 2 to 3%. Experience long-term success. But when you have someone who has the compassion and the grace and the mercy of someone who's faced those same fears, those same stresses, the same guilt and shame, that they can really feel that. But yet they also know all the tricks and they also know all the rationalizations and all the justifications. And it's like, sometimes I'll talk to a guy and I'm like, okay, are you done? Because I've heard this before. You don't try this on me, and they snap up real quick. The other thing that's important is, and I had a question asked about this before, is like, so when do you know when to really push on a guy and when do you know when to fall back? That's something that I don't think anyone who hasn't walked in our shoes, I don't know how you train someone that. You kind of know it. I've got some guys that have said literally the same things to me, but because of one person's backstory, different from another's, I pressed this guy hard, but this guy, I extended him some grace and I gave him some encouragement in the same situation. But now, a week or 2 weeks later, I may flip it around. And I don't know how you teach that. It's just, it comes with the territory of having lived through that brokenness.